Hi, everyone, and welcome back to our panel. This segment is dedicated to our wonderful providers here in Florida. So, as you know, if you've been watching along, or maybe this is your first segment that you're watching, we are celebrating Transgender Awareness Week. I am Angelique Godwin. I am the Director of Transgender Equality, and I have been putting together panels to showcase and uplift some of the different organizations and smaller communities within our communities and highlight some of the different professionals that help our community out here in Florida specifically. And so we're just here to talk about busting myths and breaking down the stigmas that surround the trans community. So hopefully by the end of this, you'll have some education, you'll have some good spirits to stand upon, and you'll feel a little bit better about the trans community. So I'm going to have my two special guests who are providers here in Florida introduce themselves. We'll start with you, Dr. Bob.
Good evening, everyone. I'm Dr. Bob Wallace here in St. Petersburg, Florida. I've been a physician practicing for 42 years, graduate of University of Florida in 1982. My clinic is called Love the Golden Rule. It's all about treating everyone the way we want to be treated ourselves. I started seeing transgender people many years ago, and after the DeSantis debacle, we have just flooded. I am so grateful. We have met so many wonderful people going through a lot of different trials and tribulations just to keep their lives as stable as they can, and just really grateful to be here. Thank you for letting me be part of this.
Dr. Bob, it's a pleasure meeting you. Hi, everyone. My name is Dr. Mo. I'm here in Northeast Florida. We provide gender affirming care. I'm an infectious disease specialist by training. And so my role is preventing HIV, preventing STDs, as well as treating people that are HIV positive. So looking at the rate of HIV infection in different communities and trans community as well, it's higher than cisgender females. And so looking at this and seeing the limitation in care that was being offered to our trans brothers and sisters, we decided let's start offering gender affirming care at Reza Health as well. So we're based out of Northeast Florida. And my training prior to medical school was in graduate school, was in neuroscience, and it was in sexual differentiation of the brain. So for me, going through grad school and doing graduate work, this is common knowledge in science that trans care is healthcare. So with that said, I'm excited to join Dr. Bob on tonight's talk.
Thank you so much for both being with us. As we've been doing with most of our panelists, we want to know, what does Transgender Awareness Week mean to you guys? Considering you work with the community hands-on and upfront and center, has that changed the meaning? Does it have a new meaning for you? If you guys want to tell, whoever wants to speak first, I'll let you guys.
Sure, I'll go. I think it's great that we're doing awareness of all different facets of medicine these days. We're seeing so many people having struggles with their own identities, no matter what's going on. But for me, seeing people have the chance to express themselves, and hopefully in a safe environment. I grew up in a time where I never heard of a transgender person until pretty much I was in college, but I was in school in the 60s where we were still learning the differences and hopefully the similarities between blacks and whites. So when we start throwing in transgender identification, gender expression, we need many more platforms to help educate the general population about who transgender people are and who they are not.
For me, it really is about reflecting on the importance of providing care to those that are transgender. It's the trust that's been placed in the healthcare system, as well as to providers such as ourselves, to be able to help people live their best life, right? What they've seen themselves as being, who they are, authentically they've seen. So this is that week of awareness to say, hey, this is support that we need to provide, that empathetic support that we need to provide, and the commitment and fostering that safe and welcoming environment to people on their gender journey, and honor that and affirm that further.
I think that I've tried to correlate my response. I've done this 5 or 6 times now. But I think as a trans person, it's so important to have people who advocate for us, especially in the healthcare world. It's so often, especially for women like myself, a trans woman of color, it's really hard to go into any doctor's office and feel safe. It's really hard to go into any doctor's office and feel like we're going to get the best possible care. And so when there are providers willing to offer an opportunity at the best quality of life when it comes to healthcare, I think that that is truly a milestone that is not spoken about enough, that there are these wonderful humans who are not only doing the work, but creating safe spaces in a place that can be very intimidating or very scary for someone who is, in a sense, discovering who they are physically or going through those changes physically. To know that they can sit in a room with somebody and feel comfortable or safe is super huge. I don't think people talk about that enough. So I'm really thankful that you guys are here to speak from that corner, but also for the work that you both do. I've had the opportunity to walk through both of your facilities and to be a patient and to have these experiences that make me feel good about sharing the work that you guys do and to talk about you guys and even refer you guys to other people I know. So this is really awesome. I'm so excited. So keeping the conversation moving forward, the big deal that we're doing is breaking the stigmas or myth busting. As providers, as people who are working in the community, within the healthcare community specifically for trans individuals, for someone like Dr. Bob, who's been doing it for a little bit, and then someone like yourself, Dr. Rosa, or Dr. Mo, who has been, like you said, a little over a year now, or almost 2 years now, you've been doing the work. What is something you guys constantly are faced with that you might see? I feel like you might have some good ones for like things that are misconceptions, maybe even that people come to you with.
Dr. Bob, I'll let you go because you probably have a lot more stuff.
Well, the first thing that came to mind when we started talking about this week is busting the myth that all transgender people are not drag queens. And I think there's been such a clouding of that picture with the government here in Florida, with all of the drag queen work that was going on, anti-drag queen, not being allowed to read, that many people just automatically assume when you say transgender, they go to drag queen. That's what I find in the general population and the medical community. There's a lot of ignorance about this because for those of us like me, this is still fairly new, even though it's been around forever and ever. And we have to also realize that we have transgender men. People don't really think about the fact that I have so many now transgender men who are incredibly wonderful people. They, as soon as they grow the facial hair and start to get dressing, it seems to be a little easier for them than I see in our transgender women who are trying to find how to express themselves, and whether they feel they want to be beautiful, whether they want to be just a voice, whether they want to be in the background and not recognized and nobody pointing them out or outing them, like one of my patients had today. She was at an event and all of a sudden her picture showed up on the screen and she was not prepared for that at all. So in the medical community, I find that it takes a lot of effort to get doctors, now particularly the older doctors. The younger doctors and the younger patients have had a great benefit by having mentors and having people speak about transgender knowledge or transgender people. So we have to continue to educate people. And I love, we're planning an event in April that we're going to do a fashion show where we're going to include transgender people and people from the community. And the bottom line is we're not going to identify who is who. We're just going to let people walk the runway, be themselves, see who they are, and let the audience just realize, hey, how many of these people really fit in and you have no idea. So the longer I'm in this, I'm seeing more just people like Angelique, who's so beautiful and just walks in with such a presence that, hey, wow, this is really great. Somebody can make that kind of a change in their life. And two of the ones I had today are the ones who still look down and they don't want to put their hair beside their face, and you watch them, and I just keep trying to give them affirmations of be yourself, be who you are, look how beautiful you are. Make sure you look in the mirror and say something great to yourself every day. Inspire yourself so that you can inspire others. And I see these people building, and it's been the last 2 years. We've started a lot of people on therapy, and I love to see them back in 4 weeks and just see the difference in their presentation in 4 weeks. They come back and go, Dr. Bob, I didn't know it would feel this way. I didn't know I would start to feel different inside. And the other part of this is watching the depression and the suicidal risk begin to just drop because people begin to see that they can be who they are. It's just a really wonderful experience, and I'm doing my best to share this with everyone I possibly can, to let people know we have to be the allies and have to get out and provide a platform. It's not just the transgender population providing for the transgender population. We as professionals, and particularly medical professionals, have to step up. Many of the colleagues in my age group, once I have a few sentences with them, I've got their attention. Oh, wow, I didn't know that. I didn't know that. So many doctors that I know, they had no idea that there was a law passed last year. They don't even know that. So a lot of work to do.
I think that's so cool. Oh, I love that. I'm gonna hold my remarks. I'm gonna let you go, Dr. Mo, because I'll bring it all back together. I'm taking notes so I can remember to come back to these things. But really good.
Oh, for sure. I echo Dr. Bob on what he's saying, and the fact that so coming through training in medicine, even I'm more 15 years outside of training, this is not something we get trained in, even in the last 10, 15 years. Hence why this is really one of the things that physicians, other practitioners that are coming through training really should be exposed to and trained in how to provide gender affirming care, right? So one of the big myths that I see is, oh, this is experimental still, or it's not completely necessary. That's mind-blowing to me. This is not something experimental. We know, as Dr. Bob is saying, the rates of depression, the rates of anxiety markedly decreases. And this is not something anybody's choosing, right? 99% of the people that I care for know that they're trans at age 4, 5, 6.
Right.
It's not something that they're waking up one morning as an adult saying, oh, yes, I want to go against the social norm of everything that society's been taught me for the last 20, 30, 40 years, right? And so that's one of the myths that I see and that I hear about. Hey, it might just be a phase or something of that nature that a lot of other people in the community will say. But really, this is in science, and coming from a neuroscience background, we know this is in every other mammal that we see. We've studied this other mammals, and it's there. It's how much testosterone or androgens you're being exposed to in utero, right? We know that this happens in humans too in second and third trimester. We know that it happens in other animals. And there have been human studies done with functional MRIs, which shows that that brain of a trans female before they've even started hormone replacement therapy is that of a cisgender female, lights up just like a cisgender female. So there's scientific evidence why this is not just a choice and not something that just comes in overnight. And all of the other things that Dr. Bob echoed, just educating our providers, just because it's not something that's provided all that often in most environments. I work at Mayo Clinic as well as a provider, as a hospital. That's where I train. So this is going to become part of their residency program to come to our clinic and work with us to provide care to this population. And trans people want to live life as they've always seen themselves live, right? They don't want to be eccentric. They don't want to be, as you said, Dr. Bob, kind of the drag queens. 90% of my trans males, you cannot. They are a man, no matter, however you put it. Trans female, it's a little bit, there's a lot more subtle changes that happen with trans females. And it's people just want to be accepted as who they are at the end of the day, right? So trans people are not trying to become something they're not. They are trying to be who they've always seen themselves to be and accepted in that manner.
Well, having had the experience also, it's believed I'm the first openly gay student to get through the College of Medicine, University of Florida, finishing in 1982. I know for a fact.
Are you really? Is that?
For a fact, was the first gay student to get through program in medical sciences at Florida State. I was the first gay resident at St. Pete's Family Practice Program to be open and accepted. There were 2 men before me. They were both discharged from the program. So I've been able to set the path. There's another young Dr. Alex Bugg who graduated from the same program I did. And it was really wonderful to know that having set the path, and it's not about me, but it was about changing the aspect or the feelings that doctors have about patients. Doctors are very judgmental. They learn certain things, and we've had to relearn what this is all about. My belief, this is all on the X and Y chromosomes, and that there was somebody in some way to make money proving that sequences on the X and Y chromosomes are just different for people who are gay or transgender. I look at my own family, how many gay people are in my family. There were 9 in my mother's family, 8 in my father's family. On my mother's side, we have multiple family members who are gay. And in my father's side, that's not the case. So we work through this fact that it is not a choice. And I always say that. Did you ask to be black or white? You didn't. Why is it then that people have such a hard struggle realizing that being transgender or gay is no more a choice than being born black or white? And we have to continue to somehow prove that. And until we do, people are still going to, be naysayers and say, no, it's a choice. And you just want to slap them down and say, wake up. This is real life.
Yeah. Y'all said a lot. Ooh, I love this. So like real quick to go back through a couple of different things. Something I love that I feel like is not talked about enough is the existence of trans men. I think that oftentimes, even in the world of like drag, trans men or drag kings, so to speak, are not a hype talk about. It's not something you see commonly in shows. It's not something you see commonly out in the open. It's something that is definitely not talked about enough. But I do agree that there's this, like, for all of the quickness, I will say that, a trans men can go through their transition to happiness. There is like a stopping point for them. Whereas with trans women, there's this thing, like, everybody is transitioning to a certain point. Nobody has the same finish line. Everybody doesn't need a full quote unquote transition, medical, physical, or a surgical transition, right? Some people are just fine with just being on hormones. Some people are happy with just boobs. Some people just want a bigger butt, like whatever the case may be, some people want all of it, I think that it's really interesting that there's this ideology that there's this monolithic form for trans individuals, period. Like trans women are meant to look a certain way. I think people judge trans women no harsher than they judge women. I think my whole life growing up, women surrounded me, and they were all shapes and sizes and builds. And I heard everybody get, picked on at some point in time for something they had or didn't have, or a feature that might have been stronger. A lot of times growing up in New York City, the Dirty Dozen was a real thing. People were battling it out and pulling out the worst traits. You look like your dad, or like, just talking about the stronger features, or, facial hair, things like that women had. And so for me growing up, I never really thought of it in that aspect until I started seeing just how poorly treated trans individuals who don't meet societal standards, beauty standards. So there, a lot of people transition later in life. That's the thing that people don't consider either. With the ability to transition earlier in life, a lot of people are having happier, more successful transitions because they're getting to that point so much faster. But I don't want to exclude the older trans people who are transitioning later in life because their parents are gone, or they finally are around people who accept them openly. And so to tune back into what Dr. Bob was saying about being the first in something, a lot of times people have to see an example before they know that that's for them. But I wanted to clarify that no one ever chooses this lifestyle. The only thing we choose to be is happy. We choose to live our lives for ourselves. We are not living for anyone else when we transition. Which brings me to my myth, is that trans people are trying to trick people. I can't believe that this hasn't come up yet. I can't believe that I haven't talked about it yet. But the ideology that somebody wants to change their gender to trick people into what? Into being attracted to them or to having, I was like, that's crazy. I'm like, there are people, like, cross dressers have existed for a long time. So that's not an excuse to me. That's not a reason for somebody to wanna change their entire life. I don't think people understand the process that we go through as trans individuals just to get on hormones, let alone have surgeries, or to change our names, or gender markers, birth certificates, things like that. That's a lot of work. It's not as easy as just waking up one day and jumping on it and being like, I want this now. Like, I remember having those thoughts when I was younger, but never having an example. And I'm blessed. I'm lucky. I tell everyone I'm a unicorn because I was raised by parents who just let me be. If I wanted to walk around in a sheet and dress myself up as the Queen of Africa with like headdresses and stuff, I was allowed to do it. I was allowed to play with Barbies. I had all the Disney princesses. I was allowed to just be myself. I never was into dresses enough to go to school in a dress, but I think if I could have matched my mom, it would have been cool just to like wear what she was wearing. We did a lot of like similar outfits. So it wasn't until I was a teenager that I even got called a lesbian for the first time because I had feminine features and I didn't grow facial hair. And then later on in life, I met trans people when I was in college. And the first trans people I met, they were the kind of people who lived as men during the day and then were women all night. So they were either, drag queens or prostitutes or escorts or strippers. Those are the jobs I seen trans women as. I never saw a CEO or a business owner or something. I think in high school we had a couple of trans women who worked the midnight shift at Walmart, because that was the only place they could go and work successfully and be fine. But I think we see a lot of these things happening and we don't even realize, right, we don't process it because we're not aware to it, we're not hip to it. But it wasn't until I met trans people and got to know them and realized that that was a choice, that it was possible, and to see that there were people in the world who didn't want or need surgery and just identified as a woman and stood so confidently and so strong and dressed and didn't need anything to be the person that they are. I think that was so powerful. It was super impactful. I think I went over just about everything. You made the comment, Dr. Mo, about the experimentational aspect of it. I kind of want to go over that a little bit more because I know that now WPATH actually has a training that they're doing, or I know I looked it up. It is not cheap, but it is a training that they're doing. What do you guys think about trainings like that? Do you think that there should be more? Do you think that they should be offered for free? I know that you guys are doing something similar to that with the kids coming in and out of school, Dr. Mo, but what are you guys' thoughts on that?
My perspective is this should be mandatory in all med schools and all residencies, in general practice and surgery as well. This is medicine. At the end of the day, this is treating heart failure, treating diabetes. This is a part of life. That hormone replacement, that it really is. Exactly. So why would you not do this for the betterment of the person that's in front of you requiring care, right? This is a cure for depression and anxiety for a lot of people. We see that across the board. Dr. Bob sees it. I see it. They get on hormone replacement therapy. Oh my goodness, that anxiety is gone. That depression that I had for the last 20 years that I was diagnosed is gone, right? So it fills my heart as a new provider in this field just to be able to help people transition. They've been 20 years living as someone that they didn't see themselves in the first time they do. After 6 months or 9 months, they are crying in front of me and just gives me chills that finally I get to look at the mirror and be the person that I've always seen myself be. That's why we go into medicine, to be able to help people. So that really is in the core of this.
Well, you're making a comment too about the first question I always ask my new patients is, how old were you when you felt like something was different for you compared to the other kids? And it always surprises me that they have to really think about that because they've had to suppress it for so long. They can't honestly say I was 5. And the most common answer I get is around 9. And mostly it's because most of the trans men that I see, they never wore shirts as kids growing up. They didn't wear shirts and they played with all the boys in the neighborhood. And all of a sudden, oh my, something's changing. And then something else changes. Where'd that come from? So, and parents had not had the opportunity to learn and trying to see, particularly these Christian groups that are trying to just de-homosexualize people and the trauma. I have so many people that have been traumatized by being forced into therapy to change them to just not be gay, let alone transgender. I think it adds, a number more levels and layers to the complication of how we can help people. And we've got to have good therapists that can help people walk backward and see, where did I change? How did I feel? It's not my fault. I didn't do this to hurt my parents. And that was the first thing my parents said to me when I came out in 1976 is, how could you do this to us? And it's like, how could you do this to me? And they actually told me not to come back. I didn't see my parents for over a year. But by the time they died, we were best friends. They were my best allies. They were my best supporters. So I've had that experience. And I work with so many people. The other day, she said, well, my parents are about 85% accepting. And I said, well, that's a right step in the right direction. But just the fact that there's an awareness now, and no matter what you think about Bruce Jenner, Caitlyn Jenner is coming out. And there was a lot of strangeness in that story. And because of so much money and ability to do things, I think that sort of scattered a lot of young children. They don't have that access. They don't have the money to do this. And my heart just breaks for these people coming in that I see that are in their 50s now, and just now being willing to take the chance, and how much they lost in 50 years of not being able to be who they want to be or who they are. It's just having to make these choices. And all of the men, I have a number of gay men in their 60s who have children because they forced themselves to get married and have children and go on. And then the trauma of having to get their children to accept them, and some do and some don't. But it just, there are so many pathways that so many people have walked that I always tell my transgender patients, there is no cookie cutter treatment. Don't come in here with a guideline book and tell me that you have to have this much estrogen and you have to do these drugs to get where you are. It's an individual treatment, and some people will look at it and say, wow, you were totally wrong. You didn't give that patient enough medicine to do anything. Well, they didn't want that much medicine at first. So don't force me into a guideline where someone's going to go out and say, Dr. Bob did the wrong thing. He doesn't know what he's doing. Is that I've looked at 5 different guidelines and they're all different. So we have to educate providers that we are now taught you have to follow guidelines. So when we come to a situation like this where there aren't guidelines, it's a challenge for particularly physicians in my age group. They don't have a guideline, so they don't know what to do and they don't want to do it. But we're trying to find, I've just been so swamped as a provider, not being able to get out. I've just hired another new practitioner and a new COO so that I can start getting out in the community during the daytime and talking to people about these. I also have, I'm a hepatitis C provider. I still have to educate providers that you can treat someone who's still actively using and save 20 lives. You cure a patient of hepatitis C and you've saved 20 more lives. Why would you not want to do that? So here we are with the transgender group population that can get someone who's been protected or covered or had to hide, who could be out there and be a mentor for 20 more people and help keep them from going through the suicidal thoughts and depression and things. There's just such a total opening up of what we can do as providers. I am so grateful to be in this place in my life. I wish I was a lot younger so I'd have a lot more time to get more involved, but I'll do everything I can. I just feel we have to get out and help everyone. So
I love that. I definitely, as somebody who, I didn't start my official transition until I was 30. So I had lived my life, as the girls say, we live our lives, we get dressed and we do our thing. I had started working, I think my first job was 24, where I started going to work dressed as a woman, and seeing how it felt and going through it. Prior to that, I was only going out at night. So I think as you break down those barriers and you meet people and you find places where you're accepted, it definitely is an experience where you have to I remember going to my family at 30 and telling them, guys, I love you, but I love me more. I can no longer do this thing where I come, I wore nothing but sweatsuits and I wore nothing but baggy clothes and didn't care how I looked when I went out. I'd be in a tank shop and swim trunks all day long because I was I don't care what I look like. But when given the opportunity to dress up, I would go all out at the outfits, the hair and makeup, everything. I'd really put time and effort. Even now, in a position where my skin is clear and I'm happier and I don't need so much, I still have wonderful dresses and cute little outfits. The thought is there because I care not to present myself to the world, but how I present myself when I look in the mirror. And I think that that's a huge thing that people miss when we transition, whether it's young or later in life. It's about being happy with who you see in the mirror. I had a conversation with a young man, a trans man in Pensacola the other day, and we talked about how the funniest thing we learned was that when we started our transition, that was the first time we started actually looking in mirrors. I had never really sat and look. I had been doing my makeup for 10 years as an entertainer. I started doing my makeup at 19. And it wasn't until I was 30 years old and on my first set of hormones that I looked at myself and said, holy cow, I really like what I see. I like actually looking at myself, falling in love with myself all over again. It's such a huge thing. And those are moments that I don't care if anybody ever sees or is a part of them because they were for me. And that's how I knew that this was the right path for me. It was about being happy with who I was. And people will compliment me on the street and I'm like, oh, this, I was like, thank you. It's a shock. It's not like I'm unexpected of a compliment, but it's definitely I didn't put this on to get a compliment. occasionally, as a woman, women do, there's occasionally those moments where we put on a certain dress and we want a lot of commotion, right? We want somebody to say something. But my everyday life, I do not do that. It's not a thought for me to worry about who's outside my door or who's in the lobby or who's going to be parked next to me at the red light. I don't think about any of that. I'm so focused on my own joy and happiness that I can't be bothered with anybody else's thoughts. So it's really just important that you guys are keep doing what you're doing, because those people that do come in and they do find that gender euphoria, that excitement or that happiness that comes from actually finally taking the steps towards the envisionment you see yourself in your head, it's huge. Having now I'm 4 months post-op from my gender confirmation surgery. I can't tell you how euphoric. Thank you. The euphoria is consistent. It for the first time in my life, it's from start to finish. I'm not happy all day, every day, but I am happy every day. There's not even when I'm dead sick, I'm still finding moments of joy in my life. And I think that that's so wild that it took me this long and took me this particular procedure for me to notice, acknowledge, and experience that joy and happiness. So I think it does matter whether they start off. And as somebody who went through a position where they started me off on my hormone therapy very little, I had my little 2 milligram pill, but baby, that pill did more for me in 6 weeks than anything else ever did. It literally, I remember coming back into the office feeling like I was just this dainty little thing, feeling so good for my 6 month checkup, being like, this is everything. Your brain just acknowledges that. I feel like it opens up with access to it. It expands when you're experiencing that. But I think that this would be the same thing that anybody, like a man who works out at the gym, when he starts to notice his six pack coming in, or the muscles, the triceps, whatever, they're seeing the definition start to form, they get excited. Women, when they go through puberty and they get a body, or they start to wear clothing that makes them feel special. Maybe it's even getting their hair, their nails done, right? There's so many different multifacets to what gender affirming care is. And I think that people automatically always shoot to HRT or to surgeries. But the reality is that gender affirming care is anything that helps you feel more at home in your own body. And I think that's the reality that people miss. Maybe that's a bigger stigma that we need to break. That ideology that we have to be one way. There's no cookie cutter, like you said earlier. So,
It's funny. One of my friends, so we do a ride called a Res Ride as well. We started that last year, and we raised money for several different not-for-profits, Queer Trans Project being one of them. So one of the co-founders of that texted me something showing Elon Musk where he got his hair transplant as well as his jawline done. That's gender affirming care.
Yep.
That's him making him more masculine. That's what we're doing. We're reaffirming who he feels as a man, and we're reaffirming people that have always seen themselves as that gender. It's nothing different. Really, he is receiving gender affirming care when he gets hair transplant and all those other surgeries. So is every other man. So is every other woman when they get a breast augmentation, right? Same exact thing.
Transplants too. It's it's helping them feel better in their own skin and in their own body. That's the only thing you have. So I think it matters.
Yeah, when I opened Love the Golden Rule, the clinic opened in October. My very first patient was a transgender trans woman named Jamie, who was an engineer. And first it was like, I struck me, this is not quite connecting here. And she told me, and this poor woman had saved her money years and years and years. She'd been seeing this doctor in Miami. She turned 65 and he refused to do her surgery because she was 65. I had to call him up. I said, how could you possibly do this? And this was a woman who was hepatitis C positive, so in striding. And that's what really fueled me to get involved in transgender care. This was 2014. But she had saved, and how dare that doctor deny her surgery just because of a number? She turned 65. And she was devastated. And finally, we got it worked out and she got it done, the surgery. Even more important for me, I had not ever seen the results of gender reaffirming surgery. And when she came back to me, I had to remove her stitches for her. And I was absolutely blown away. I said, oh my God, you look perfectly normal. You know, it is a perfectly normal part of your anatomy. And so I just became fascinated with this. But that's really the turning point that fueled me into saying, I'm not going to let anybody not get what they want. but that she was the very first. She was patient number one in my clinic in October of 2014. So.
I love that. That's great. I'm always learning something new about you, Dr. Bob. That's amazing. But yes, does anybody have any last comments on what we've spoken about so far? Anything else you want to throw in there at all? No, we're good.
I could talk forever. I have story. I have
I
story after story with 40 years of
love
doing
it.
this.
It's so much better when you guys are hyped for it. But
yeah, hopefully we'll have audiences to speak to, because I think the more we get out here and do these things, and just the God gift that I've been given to be an instrument, to be able to get out there and help these people, it fuels me every day. And I don't plan to retire. Why would I quit doing what I do right now? So
when you love it, right? Yeah.
you love it.
Oh no, well, go ahead, Dr. Mo.
No, I second that. I'd say it's funny. So we do weight management as well at our clinic. So we help lose weight. So with those Ozempic. So funny story that I had. So I'm helping somebody transition to a trans female, and we're helping her lose weight as well. And she works as a curator at a museum. And she's standing there one week. I saw her the week afterwards, and she's like, "Dr. Mo, I started crying last weekend while I was at work." I was like, "Oh my God, is everything okay?" She's like, "No, I loved it." And I was like, "What happened? Why were you crying?" She's like, "I was thinking of soft shell tacos from Taco Bell. And I was so hungry but I didn't want to eat, but I was just thinking of it because I didn't have the hunger, and I just started crying. And I loved the emotion I was going through. I was like, this is what women must feel, like the emotion. I was like,
yeah, the things I've seen now is I watch my trans men come in, and they're always sitting down like this with their arms crossed, and they get their surgery and they come in like this, standing up straight and strong. And I said, go for it. Let everybody see how beautiful you are, and how, you don't have boobs anymore. It's like, how about that? And it's just, I just see getting more and more experiences. I'm seeing now, I'm a family doctor, and I have a huge hepatitis practice. I have a huge PrEP practice. I have a huge HIV practice. I just don't have enough time to get to see all the people that I want to see, because our transgender learning is just like back in the AIDS days when I was doing clinical research, and we would finally get a drug that would help people feel better and not have them in the bathroom 12 hours a day being sick. And now one pill once a day, we have 10 different combinations. And so getting the opportunity to visualize this growth and see things, I just can't share enough. I just want to stand out and speak to the whole world. It's like, get out there and do something. Get out there and help somebody. There's every avenue that you have to get out and help somebody. And now this has become my focus. I want to see all transgender people be happy, get what they need, be protected, and be safe in a country that none of us feel safe right now. The LGBTQTIA community, we're devastated with what's happening. And it's just something we have to stand with our sisters and brothers and find some way to get through this. And it's all about positive attitude, treating other people the way you want to be treated yourself, and never giving up. Just don't stop the fight.
So we'll close out with our favorite question that we have here. We gotta call it the Thanos Snap question. So you guys are both going to take a second to answer. It is, what if there was one myth or one stigma that you could erase in a snap, what would it be? I'm going to start with you, Dr. Mo.
So this took a little bit of time to think about it. There's so much we want to change. There's just so much misconception, and just harmful misconception, right? So I think one big thing is that gender affirming care is harmful or irreversible, right? So it's not. I have clients that it's gender fluid, and it's not that you have to be one gender at all times. This is something, what feels right to you, as Dr. Bob is saying. Yeah, there's guidelines. You don't want to go way above what the recommended hormone levels are, but really it comes down to the person sitting in front of you. Where do they feel comfortable? Regardless of what their hormone level, if it is in the normal range or if it's lower than what's recommended. It really comes down to, just kind of getting rid of this misconception that this is harmful, this is irreversible. It's not. It really is, lets people be who they are and live their life, not as an outlier, but as a part of society, as being a part and accepted for who they are. That'd be one thing, one myth.
Yeah, and Andre asked me this question last week, and then I've had the whole weekend to think about it. But my knee-jerk reaction is still the same. Transgender people are not all drag queens. Just stop thinking that way. We have to realize that many drag queens are incredible entertainers. There's a play on Broadway now, Drag the Musical. I actually signed on to be a producer of that play, and it's going to go to Broadway. It is a fabulous production about, it's just a story of two drag queens who broke up as partners, and they set up, competing shows and bars, and then they finally get back together and join in to continue to help the transgender population. But that's my knee-jerk reaction, is just stop thinking that transgender people are all drag queens. There are a lot of men out there, so let's give them their space and the opportunity to speak out.
I love that. Thank you guys both for coming on and sharing your wisdom and all of your point of views. You have definitely given us lots to think about. I know I'm excited. I look forward to having more conversations with you both. But yeah, that's all we have for our segment today. Thank you again to Dr. Mo and Dr. Bob. You can check them out. We're going to post their information and connections in the video link on YouTube when it's available. You guys will be able to get in touch with Reza Health. Is located in Northeast Florida, which is like Jacksonville area. And then Dr. Bob, who is located in St. Pete, Florida, with Love the Golden Rule. So thank you guys for being here and for sharing all of the wonderful things that you're a part of and all of your great stories. Bye, guys. See ya.